Hi, and welcome back to the Why-O-Myo podcast. This is Janine Stiene, your host, hoping to answer your questions about the who, what, where, when, why, and how when it comes to myofunctional therapy.
Disclaimer: all content, details, as well as education shared on this podcast are the opinion of the speaker and are for informational purposes only. Please consult with a certified medical professional regarding any questions or concerns, as this podcast should not serve as a diagnosis or replace the information received from a healthcare provider. This is part 1 of a 2-part episode. Stay tuned for part 2, coming soon.
I want to start today by discussing how to get a myofunctional therapy referral, who should you get it for, when is it necessary, and when is it recommended. And if you are a parent listening to this and you do feel like your child is in need of myofunctional therapy and you go to your school SLP or school speech pathologist or your child's teacher, and they look at you like you have two heads. And I will say, up until 25 years ago, I would have thought the same exact thing. I would have felt the same exact way. And so much of that is because myofunctional therapy is not something every speech pathologist knows. Myofunctional therapy programs are not all equal. When you are looking for a program, you need to look for a program that is based on need. So the parent may ask you some of these really specific questions, and maybe you know enough to say they don't do myofunctional therapy in school, which, just so you know, they don't. They may not know the answer to many of your additional questions because we are never taught myofunctional therapy, and we never learned it in school. And I would say just in the last couple years have we seen anything about myofunctional therapy come across any national speech examination. And for a long time, everyone was so anti-myo. And I know that the pendulum has swung the other way. And people are looking for it, they need it, they understand it. When I started doing this, like I said, people looked at me like I had two heads. I would walk around to pediatricians and dentists and orthodontists, and I would not recommend myself, well, I guess I did, introducing myself and saying what I did. And especially the dentists and the orthos, many of them looked at me like, I don't know what you're talking about, or I don't do myofunctional therapy, I put in habit breakers, or they have heard about it but don't know much about it, and would we be willing to educate them about it? So it was quite eye-opening, especially when the question we often get from parents is, how come my pediatrician never picked this up? How come my dentist never recommended this? How come my orthodontist has never recommended this? And there's no answer except to say, I'm not sure if they know what it is or what they're looking for, or they didn't know there was someone out there that actually treats that. And finally, that wasn't being told, go to your school and ask for a speech therapist, tell them you need myofunctional therapy, and it will be handled through the school. Or through early intervention or CPSE. And just so you know, they're not covered by any of those things. They're not covered in school. And the reason is because it's considered a swallowing issue. And unless your feeding and swallowing skills are negatively impacting upon your academic performance, they're not allowed to touch that portion in school. So they are not performing therapy that addresses the swallow every day or every couple days, and because it's not affecting them academically. And that, when it comes to myofunctional therapy, if it's not affecting them academically, negatively affecting them academically, then there is very little chance that you're going to get services anywhere or on the outside or outside of CPSC, EI, and schools. Now, as a parent or a practitioner, the next thing you would probably say is, let me recommend someone, or I recommend you see a myofunctional therapist. I hear there's someone in, I don't even know, I'm trying to think of a false name. There is someone that lives in Mount Sinai who does myofunctional therapy. And at that point, you either call your insurance and see if they could help with the services. But the next thing you do, back in the day, you used to look in a book, but now everything's on a website, and I'm dating myself by saying a book. And you wanted to be in that book. It was like such an important book. I know I'm going off on a tangent, but it was like your yearbook where your boyfriend wrote you a love letter with a big heart around it, and you want to hold on to it with your life, and you really want to be in the book. It's like a popularity contest. You really want to be in the book. It's a perseverance contest because some of them were really hard to get into or closed off. I'm sorry, I know I'm going on a tangent, but that's what happened back in the day. It doesn't quite have the same effect now that it's online and we can look it up on a website. I don't know, it doesn't feel as inclusive. Maybe because online is like a huge platform to say this is online. So you look in your book and you look for speech pathologists and you start making calls. And when you call, you're going to ask whomever, I was wondering if you offer myofunctional therapy at your office, and see what they're saying, and then ask if it's offered by a speech language pathologist, or that's also a myofunctional therapist, or is there another type practitioner that is providing those services. And sometimes we'll see that many dental hygienists are insanely good myofunctional therapists. However, they may not be able to address some of the skills that a speech pathologist would be able to address. Just like if it's myofunctional therapist is a chiropractor, where a speech pathologist and a dental hygienist are not going to be able to do the additional things that the patient may need relating to chiropractic, and so on and so forth. So you want to find out, as you call the practices, do they have a myofunctional therapist? What type of professional is the myofunctional therapist? A speech therapist, a body worker, that fits a whole range of people. including the chiropractor and the body worker and the massage therapist and a multitude of others. And then if it's a dental hygienist. So looking and asking these questions are not only important because if your child is having difficulty saying certain sounds, and when I say saying certain sounds, they're not misarticulating, they are misplacing. And that sounds, I know, kind of like a semantic game, but when you have speech issues that are specific to myofunctional therapy, the issue is placement. So where the patient is placing their tongue to make that sound. So I'm just going to explain that a little bit just in case you are a parent or a therapist and you want to do this little test. So the very first thing you're going to ask is where's your tongue resting at this moment? And where is it touching your teeth or not touching your teeth? If it's touching their teeth, that could mean that they have a tongue thrust. Now, I want you to say the word lollipop, and you're going to watch your patient say it, or you're going to watch however it's being said. And if the L sound, as in lollipop, is misarticulated and instead they're using a W and say wowie-pop, or a different sound, any sound that is different than the L sound, then that is not a myofunctional therapy articulation disorder. That is a traditional articulation disorder that needs to be worked on with a speech pathologist. When someone says, or when you have an issue with the L sound, all it means is that you are sticking your tongue between your teeth when you say the L, when it should go to your spot or up against, not against your back teeth, but a little further back where you feel your bump. So now if you're a speech pathologist and you see that patient, you want to see them for myofunctional therapy. Again, is their tongue going through their teeth? Now, if they are a patient that has a lisp or changes the R to a vowel, it sounds like, or a vowel, strong vowel. People say it sounds like a Boston accent, and they use, say, the mother, and they turn it to this aw or sound, or the bird, and that sound gets rounded to a vowel. Those are called vocalic R's, and that is considered something that is treated by a myofunctional therapist. That's also a speech pathologist. If the child is changing the R to a W, like the wabbit instead of the rabbit, then, or carrot, they say cowit with a W, then that is a traditional articulation disorder and is specific to a speech pathologist, depending on age and pattern. It may be something related to phonological awareness, and that's a whole nother area of speech. But if they're lisping, any of their S's in Sam, Z's in zebra, SH is in shark, CH as in chair, the J sound as in jar, and the zh sound as in measure, then those all are distortions of that sound and therefore treated by the myofunctional therapist, who is also a speech pathologist. Now, if your child is tongue-tied, meaning that little piece of skin under their tongue is short, and they need myofunctional therapy before and after they have a frenectomy, then depending on who's making the recommendations, the therapy may be put back on them. So, for example, if a lactation consultant is seeing a patient and it's an infant and they're tongue-tied, they will ask for an oral surgeon to look at it, and the oral surgeon will want a lot of stretching done before and after. Now, that is often done by a myofunctional therapist. There also could be body workers that do that as well. Now, if the child is in their toddler years, the best person to identify the issue and even potentially pick up a tongue thrust would be the pediatrician and the pediatric dentist. However, there's no guarantee that they've ever looked at the frenum, especially if their feeding and weight has been and growth has steadily been improving, because there's just no reason to look at it, again, unless there's something that could be contributing. But I do feel like for a while, even those symptoms, their first recommendation, if you had reflux, the first recommendation or the first thing would be to look at the frenum, and then if it was short, make a referral, because by releasing their frenum, often the symptoms that they are presenting with go away. Or after they have the frenectomy and they have some therapy, those symptoms go away. So if your pediatrician is not aware to or even cognizant to think of the frenum, then by all means, if you're a parent listening to this, it's important to ask, and it's important to always ask. And knowledge is power. So if your gut says the frenum looks short, the worst thing you could do, which can also be the best thing, is make a referral to an oral surgeon, preferably who uses a laser. And actually, I would say always uses a laser. And we could go into that in a different episode, but it uses a laser to redo or to eliminate or remove a tightened oral tissue or release tightened oral tissue, and ask them to also look at the labial frenum and any buccal, so any of the cheeks that may be tight, that buccal cavity, and may require it to be released as well. And if you're a speech therapist, you or a dental hygienist or anyone else, you would always want to ask them to look at everything when you're there. Why not? Even if you have had the procedure before, it doesn't mean that it did not reattach. especially if exercises were not done after the release, because the adhesions form and will reattach the tongue to the floor of the mouth. So you may have to do it again because you got very little benefit, if any, from the first time. So don't be afraid to ask that. But as a parent or a patient, you can ask them to make a suggestion, or I usually will send something to the oral surgeon and I'll write it on a script pad that says, please rule out any buccal or any tongue ties, lip ties, or buccal cavity ties. And there it goes into that professional, the oral surgeon's hands. Now, I know there are many other professionals that do tongue tie and lip tie and all sorts of releases. And however, I am partial and a little biased too towards the oral surgeon, just because having it done at the oral surgeon, and even if it's an out-of-pocket expense, I would do it at the oral surgeon, because if you have surgery on your knee, you go to a knee specialist or an orthopedic surgeon that specializes in knees. And if you need surgery in your mouth, you go to an oral surgeon. And not because everyone else is not proficient in the area, that's not the case, but more so because so often the tightened tethered tissue, or those frenum that are short, are going to interfere with a multitude of dental related issues. And it's important because the oral surgeon has that knowledge that they can assess all of the ties in relation to that. It is important that your doctor, whomever you go to, whether it be an oral surgeon or a pediatric dentist, nope, that's not true. I have had one pediatrician, and that's just here. It doesn't mean that that's the case everywhere, that can perform the frenectomies. So, I just, like I said, if it's surgery in my mouth, I just go to the oral surgeon, and for the reasons I mentioned. So that's the second time you could identify if the frenum is short. So the first time is during literally the second you're born, or right in your few days old. And even in the hospital, you can ask, can you check their frenum, especially the one under their tongue and their lip. You can do that immediately following delivery, because if either are short and you are planning to breastfeed, it is going to hurt. The child may have difficulty latching. The child may have difficulty sucking. The child may have difficulty digesting. The child may have reflux. You may wind up with mastitis on the breast. There'll be so many things that could potentially be what you're about to experience because it wasn't picked up soon enough. And I do go back to the fact that if you look at it and you are not sure, then bring the baby to the oral surgeon as soon as possible. Let them look at the baby, especially if your gut says that you disagree and it's short. The best thing and the worst thing that can happen is the oral surgeon disagrees. Now, yes, you could definitely ask your pediatrician, but once again, it's not something that pediatricians just think of immediately the second someone reports all of those symptoms. And that's coming. Like, the research is coming. Myofunctional therapists are definitely having more of an effect and more of an influence on the medical and dental and all of those fields outside of hygiene and speech. And the more the public becomes aware and the more they ask for these things, the more educated they will become and we will become. I go out and educate as much as I possibly can about anything and everything related to myofunctional therapy specifically, because the more everyone knows, the better equipped they will be to identify and make the necessary recommendations.
As a reminder, this is part 1 of a 2-part episode. Stay tuned for part 2, coming soon.
I hope I was able to give you some insight and answer some of your questions regarding myofunctional therapy. Please stay tuned and listen to our Myo Minute, and tune in to our Talk the Talk interviews with the many different medical, dental, and rehab professionals as they elaborate or answer your questions and address your concerns directly, especially when it's related to speech-language pathology and myofunctional therapy.